And actually, Beck gave a perfect answer to a question that is a segue to the next presentation, which is by Nicole Eck, who has joined me on stage, and myself. And what we're talking about this morning is how to measure strategic success. So how do you measure impacts? How do you measure outcomes? How do you measure outputs from various associations? So I'm not only the moderator this morning for this section, but I'm going to be presenting in this particular session. We'll just wait for our slides to come up. Do you have a clicker too, Nicole?
I do.
Okay.
So, good morning. I'm Nicole Eck from the ALS Association. I'm the Senior Vice President of Operations, and I'm honored that Cathy asked me to come and speak with you today around, I think the Fight M&D folks really set us up perfectly for talking about how you actually measure impact. So we're going to go through quickly this agenda. We're going to talk a little bit about strategic management and sort of what that means to us, to Cathy and myself. I'll give a little bit about the ALS Association experience with measuring impact, and then Cathy is going to talk about her experience at the International Alliance and how they're measuring their outcomes and their impact. We'll talk a little bit about some tools available, and then we'll talk a little bit about outcomes versus outputs, and it's a kind of important distinction that we want to make today. And then we'll finish up with a call to action. So I'm going to talk a little bit about sort of the strategic management side of how we approach it at the association, and I think it's actually aligned with how Cathy approaches it at the International Alliance as well. So in order to realizing strategic management is sort of the first step. Aligning your resources toward a single goal, ours being making ALS a livable disease by 2030, is extraordinarily complicated, especially when you're an organization as large as ours. And internationally, I think we want to talk about a little bit more about how we can do that together, and we'll set that up later in our call to action, is how can we better align ourselves to make ALS a livable disease or to find a cure together as an international organizations. We also want to, the second step is to really gain insights. And that's sort of the information gathering phase of your strategic management, ensuring that you're an effective organization. And it's extremely important for how you set yourself up for actually achieving your outcomes. The next is to sort of make sure that you're assessing, you're analyzing, making sure you're making the greatest impact with all of the different tools and resources that you're allocating. And then allocating and improving, constantly looking and improving what you're doing. That's been really, really important to us at the association, to constantly look at, are we doing the right things? Are we hitting the mark that we need to hit? And what do we need to adjust in order to make a bigger impact? And then communicating that impact to your stakeholders. And I would say that, and as I walk through the ALS Association experience, I would offer that that's probably one of the more complicated things in terms of actually measuring and being able to communicate the impact that you're making. And we're starting to make some progress on that, but I'll go through that a little bit more. I think that, all of these, support leadership to make informed decisions that drive meaningful outcomes, and maintaining accountability and transparency, and to the internal and external audiences and the people that you serve. I wanted to kind of share a quote from a partner of mine. We partner with a company called Cascade Strategy, which is the tool that we use to measure everything that we're doing. And Danielle is our key partner at that organization, and she wanted to share with you all that, and I'm going to read from the card, so I'm quoting her directly. Ruthless prioritization and alignment to strategy is more critical than ever in the non-for-profit space. You're often being asked to do more with less and to optimize every dollar. Strategy is all about ensuring your activities are having the intended impact, identifying risks to success early, and ensuring you are delivering real results for the community that you serve. So I'll talk a little bit more about the ALS Association experience, and I would say it's been quite a journey. And I'm just going to pull a couple of notes up here so that I'm staying on time. I would say, first off, in our journey, measuring impact is a continuous process. It requires a lot of resources, but I think most importantly for all of us, it requires a commitment to do this. That's really the first step. Once we made that commitment, I think that dedication is starting to show those results. And after a 2-year commitment, even though this is not a linear journey, we've invested in this for the last 2 years. And after a 2-year commitment, we are actually starting to see those benefits, and I'll go through a little bit of that more directly in a few minutes. But you have to continue to evolve. So the first step in our journey was to figure out what system we were going to use. So in 2021, we implemented the system, as I mentioned, called Cascade. And it's really a system that we didn't really know what to do with it at first. We first had to sort of gather all the information from across the country and get it inputted into the system. Believe it or not, even though it says that it's not one of our most challenging areas, in terms of starting off, it was very challenging of figuring out how do you get all of the work that's going on across the country into one system. And I would offer that, as the ALS Association is obviously a very large organization, and with 436 employees, making sure that we were getting into a system what everybody is doing on a day-to-day basis was very difficult. The second was looking at all that information when you get it into the system and making sure that it's aligned to your strategy, your overall strategy. And I am going to briefly go through our strategic priorities in a few minutes. But looking at alignment was extremely important. But I think as you started to identify all of the different things that you put into the system, you started to realize there were also a lot of gaps. Even though there's so much work happening, there's so much work that needed to be better aligned, and we identified a lot of gaps of things that we weren't doing in certain parts of the country and things that we needed to change. The next step was really integrating across the country, everybody understanding the system overall. I think the visibility of the system is extremely important. We can now see the work. We can see all the projects that everyone is working on. Right now in our system, we have over 800 projects that are happening across the country. That's a lot of projects. And it's also, given us an opportunity for looking at what of those projects are redundant, what of those projects can be better aligned. And that's an extremely important part and a very difficult part to figure out how to be better aligned. One of the things that we found with the system is it's created a level of accountability that I don't think we imagined at first when we began this journey. Like I said, we can see all of the projects that everyone is working on across the country. There are about 140 of our staff that are trained on this system and that are engaged in updating it and inputting their work on a regular basis. And I'll talk a little bit about how we report out on those things. But it has truly created a sense of accountability across our organization that we never had before. I can go in and I can look at the care service staff and how they're delivering their work in the state of Minnesota right now, if I wanted to. That is something we couldn't do 2 years ago. The measurement piece of this, which is the next step, is extremely complicated. And I think, as they pointed out earlier, defining the metrics for your outcomes is probably the hardest part. But it's also the most important part, so you can show what kind of impact you're making, and are you doing the right things to support the community that we serve and to find a cure for ALS. The next is, of course, as I mentioned, communicating the impact. I'll talk a little bit more about that in a minute. And then, the opportunities are to continually assess, as I mentioned before, constantly relooking at your strategies and redefining where you need to be. So the most important part for me, what we've learned in implementing all of this over the last 2 years, is it's extremely important to drive a strategic culture across your organization. And that requires people, which are the most important part of any strategy, everyone moving in the same direction. It requires process, which are all the processes and training you get in place to get everybody engaged with the system. As I said, we have 140 of our staff that are regularly inputting data and updating into the system, and the technology. As I mentioned, we are using a company called Cascade strategy, and the technology has been, it takes essentially 2 full-time staff to ensure that everybody is trained, using the system properly, and that we're getting the actual outputs that we need. So I'll walk you through a little bit about our strategic plan and our priorities, just so you get a sense, because I am going to give you a little visual of our system itself. So I want to show you exactly how that's set up. So our priorities the ALS Association is to ensure access and prevention. We want to empower and engage people living with ALS to engage with the world in the way that they want. We want to reduce burdens, physical and emotional and financial burdens. We want to ensure that people have access, ensure support for all people living with ALS. And we want to create accountability to ensure that there are meaningful impacts to people living with ALS. And that's exactly why we started this journey, was to create a level of accountability to our work so that we can show the community we are moving in the right direction towards making ALS a livable disease by 2030. This is how our strategic plan is set up in our system, essentially. So you just saw the strategic priorities. Those live at the top of our system. One level below that are our objectives, and we have about 100 or so objectives. It might be too many, but there's never enough, right, at the same time. So we are going to start refining that in our next strategic planning process, which will begin next year. The next level below that are the key activities and programs. And those are essentially, all of the activities that happen in order to achieve a certain objectives. And then, as I said, we have 800 projects happening across the country beneath that. And then there are obviously your day-to-day tasks. All of those things live in this system, believe it or not. And that's why the system is required for us, because we are tracking so very much. The way that we report out, and I'm going to read sort of from the bottom up so you understand how we are reporting out on our outcomes. We do general updates for all staff, and those happen twice a year. In the operations report at the project level happens twice a year as well. We do a report for our senior management team, which is at that key activity and program level, and that report happens 4 times a year. And then we have a board report that happens prior to every board meeting to inform our board on our progress. And as I said earlier, in terms of communicating your impact to the general public and to the community that you serve, this is something that we're not quite there yet doing. And so we're starting to build out sort of that impact report for our external stakeholders and the people that we serve. We're not quite there yet, but it's the most important part of this journey, in my view, to be sure that for a level of transparency of the work that you're doing, I think it's one of the most important parts. This is a little bit of a view into the system, and I'm not going to read anything on this slide, but just so you know, this is a bit of a snapshot of one of the areas of the system. I can go in, as I said, and look at any given objective or any given project that's happening across the country. I can get an update on that. I can see its current level of completion. I can see what committee of ours owns that particular objective, and I can see what the due date is. And then if I clicked on one of those, I can actually see all the various updates that have happened this past year. And I can tell you, on an annual basis, we measure this, and this is really kind of how our performance is measured by our Board of Trustees. Right now, for our 69 goals that we are focused on for this year, for 2023, we are at about 76% completion at the end of last month. So we still have a little bit of work to do. Our fiscal year is a little odd. It ends at the end of January, so we have till the end of January to be sure that we are close to 100% completion of all the various pieces in that system. So just to remind, because I've given you a lot, to remind you what, in terms of the journey that we've had at the ALS Association, what has been most important is, again, first off, making this commitment to do this, to track all of the work that you're doing, and to start figuring out how to communicate to your stakeholders. be very intentional about this. Don't just throw everything at a system, which honestly we did at first. And now we're going through a period of extraordinary refinement and figuring out what needs to be better aligned. Where are the gaps that we're missing some of the work that is in the system? There was a lot of work happening out there across the association that wasn't really being reported out on or documented in any way. And so being sure that you're very intentional about what you're putting into your system if you're using a system. And then, as I said, refining that over and over and creating a level of accountability within your organization internally so that you're accountable externally as well to your community. I'm going to turn it over to Cathy to talk a little bit about her experience, which is similar but different.
Absolutely. And I just want to engage Nicole in this part of the conversation, which is when we first started talking about this session, we were talking about strategic planning as a whole. We narrowed it down to strategic outcomes, and we talked a lot about the cascade system that Nicole has shown you. And I'm sure there's many of you in the audience that are thinking, well, that's all well and good for an association the size of the ALS Association, but we're quite different, or we're quite small, or, we have a different set of circumstances. And that was, of course, my first reaction as well. But it actually doesn't matter what size you are. The theories and the importance of measuring strategic success are equally important, and that's why we decided to use the International Alliance as the other end of the continuum, if you will. And our confidence monitors just went off, just so you AV guys know. But that's okay. Anyway, I'm the contrast to what Nicole just had to say about strategic success, because we at the International Alliance are the other end of the continuum. I already told you this morning at the annual general meeting that we have the equivalent of 3 full-time staff for the whole year. In terms of how we approach measuring strategic success, we actually follow exactly the same process that the ALS Association does. So I just borrowed their triangle for the slide, and I thought I'd explain what we do at the Alliance at our scope. So in terms of strategic priorities, our board of directors gets together every 2 years. The last time we got together was in Edinburgh alongside the NCALS meeting, and the board of directors sets our strategic priorities for the International Alliance along with our advisory council chairs. And we have 3 strategies: community, capability, and capacity. They're fairly self-explanatory. I'm not going to go into a lot of detail in terms of our strategic direction at the Alliance, because you're all part of our community and therefore understand what we're trying to do. We don't have 69 goals. We have 8. The board of directors sets the goals for the International Alliance. And we just went over these goals yesterday at our board meeting and recalibrated a little bit for 2025. So those are done annually. And then within that, most associations would have these 3 key activities, but the Alliance has education, advocacy, and research that we work on. Within that, I haven't listed all our projects, but we have a number of projects in terms of how we deliver on education, advocacy, and research, including our roundtables, webinars, this conference, the Fundamental Rights Survey. We have roundtables on things like optimizing clinical trial outcomes, and we have a project of working on clinical trial networks in the Global South, just to give you some examples of some of the projects that we work on. And then for every project that we have a critical path at the Alliance set up in the we don't have an outside system that we use. We do everything in Excel and store it in Dropbox so that everyone can see it. So I just wanted to really use the same framework as Nicole to show you that scale is irrelevant. When I started out my career, a long time ago, back when the earth was cooling, it seems like. I used to work in payroll, and I used to teach about payroll, how to pay people and how to be compliant with the Canada Revenue Agency. And one of the things we used to say when we taught payroll is you have to be equally compliant if you're paying one person as if you're paying 10,000 people. And I think the same thing applies for strategic direction and strategic measurement. You have to be equally aware that you have to be aligned. In that first slide, that Nicole showed, all of those steps apply, even if you're a completely volunteer-driven organization. You have to know what you're doing, what you're aiming for, and what you're trying to measure. So anyway, I spent a long time on that slide. So I'm also going to give you an example similar to what Nicole did in terms of the International Alliance experience. As I said, we have 3 strategic directions. Our capability strategy is all-encompassing because it's the one that addresses education, advocacy, and research. And so I've just highlighted that one sentence in there in terms of delivering professional development that includes the annual Alliance meeting, but also provides member value throughout the year. So that sentence was added in 2019, and that is when we started to offer the webinars and the roundtable programs to stretch out the association's education experience throughout the year. If that's for me, I'm busy. No. So the fact that we made that or added that sentence in 2019 set us up very well for the pandemic because we were already ready to offer virtual education throughout the year. So that's the strategy piece, the piece at the top. And then, as I said, we have a number of goals. We have 8 goals. And one of our goals is to engage members and other stakeholders in our community in meaningful education opportunities. So you can see we have some very specific metrics around that. For the Alliance meeting, it's not so much about the number of attendees, but the diversity of the attendees and attracting new members to our community. For the APF, the Allied Professionals Forum, it is about the number of attendees. The fact that it's hybrid is very specific because not all allied health professionals can afford to travel to different parts of the world. And you know from our attendance that about half our audience is virtual for the APF, so that's a very important piece. We have a minimum of quarterly webinars with a minimum of 30 attendees. Most of our webinars, because of time zones, get watched afterwards in an archive format. So that's why the number of live attendees is actually relatively low. And then semi-annual roundtables, which include all our stakeholder segments on meaningful and timely topics to the ALS MND community. So that's that next level down in the triangle. That's our goal specifically about the education part of the Alliance. And then how do we capture that? How do we measure it? We don't have Cascade, as I said. We use Excel, which I think everybody has access to. And so we have, this is an actual screenshot of the sheet that everyone who touches on the Alliance, every contractor that works for us, fills this sheet in every month when they send their bill to the Alliance to be paid. They tell us in that column that's blank to the right what they've worked on to help achieve those goals. So it's a pretty simple system. As I said, we only have 8 goals. So, one contractor who works on our technology might only have bullet points beside number 8, which is our capacity strategy, whereas Jess, who works on all our programs, is going to have a whole bunch in lines 2 through 7. And we're not asking for paragraphs and reports or anything like that. It's just simply bullet points. What have I done this month to help advance those goals? And then what I do as the executive director is I look at those reports every month and I report out to the board quarterly. So again, comparing to Nicole in terms of her chart, we do exactly the same thing. We operationally report monthly, and to the board we report quarterly on specifically these 8 goals. And it's really easy to see if we're working on something that's not aligned with these 8 goals. Nicole quoted her colleague Danielle, I think it was, about making choices. And there's a strategy guru by the name of Roger Martin who did a lot of work with Procter & Gamble. And I probably won't get this quote exactly right, but he's famous for saying, with strategy, it's as important to choose what you're going to do as to choose what you're not going to do. And this really helps us with alignment. If we're working on something, it becomes really obvious if something is a pet project or a shiny object that someone wants to do that isn't quite aligned with our goals. And I'm probably the worst at that because I like to say yes to everything. So this keeps me on track. So as I said, we roll this up into a board report, and then that board report rolls up into our annual report every year. So what we presented at the AGM this morning and what we have on our website in terms of the annual report comes from those Excel spreadsheets. And that's how we report out at the Alliance. And Nicole and I are both going to talk about this one. This is a model that we borrowed from the Canadian Cancer Society. And I think it's important to look at the things that are in your control or things that you have direct influence over, and then things that have indirect influence and how you measure them. Because Nicole already touched on this a little bit, there's a big difference between measuring the bottom half of the scale and the top half of the scale, and whether you've changed behavior or not. So the stuff at the bottom of the scale, a lot of us measure, and there's nothing wrong with that, but we often report out on what we've done, what efforts have we put in, what inputs are we doing into our organization and achieving our strategic goals. And we also report on activities and outcomes. So even when I showed you the example about webinars, our live attendance is an output. We had 45 people at a seminar on clinical trials or something like that. So that's a measurement of an output. But then you want to start, if you can, measuring engagement and involvement. You can do this on social media. You can do it through surveys, and reactions are part of that as well in terms of, how did you like this conference, and is there anything we could do better? Then we start to move into the influence part of measurement. And when you start to get to level 5, 6, and 7, this is really hard to measure. Level 5 is, have I taught you something that you can take back and now apply in your association? That's knowledge acquisition, and we're beginning to change the way that people do their work. It's harder to measure. It's also harder to do, but it's important to know if we are, in fact, impacting. And then the behavioral change and the end results in terms of indirect influence. So the example that the author of this chart uses to talk about end results is they were working in the cancer space 20 years ago, and the direct relationship between smoking and lung cancer is understood, but as the Canadian Cancer Society, it was hard to be at a level 7 and say what we're doing is going to lower the incidence of lung cancer. But then over time, through anti-smoking campaigns and different initiatives, in fact, the incidents did go down, and they can then measure a direct relationship over time. But it's not something you can easily measure in the short term and tie to direct initiatives that you're doing. But we all aspire to be at a level 7 if we could, but the reality is for the Alliance, we're probably somewhere at a 4 or below in terms of all our measurements that we do. And we're hoping to move the needle more towards level 5 or 6 in terms of health literacy with some projects that we're working on around knowledge management at the Alliance. So do you want to comment on this chart too?
Yeah, thanks, Cathy. I would offer that though our two organizations are a total contrast in terms of size, where we're at in this process is about the same. I would say that we're probably in the 5 stage, if you will, of this results chain, because it is so very hard for us right now to measure more quantitatively. That is something I think that, as Cathy and I will talk about at the end of our presentation, what we want to talk to you more about with all of you in the future is how do we start measuring more quantitatively that we're making progress and we're making a real impact on this disease. Right now, we have a lot of qualitative information. There's a lot of data out there, but how do you take all of that data and actually put it into a measure to show real progress? So as I said, it's a total contrast, but it's still very similar.
I was going to just make one more comment before we move on, if that's okay.
Yeah.
So one of the next steps for the Alliance also goes back to what Fiona and Beck said earlier this morning in terms of global scorecards. The collective impact of all of you is so important, and we need to do a better job of demonstrating that to the world. I'll give you just a couple of examples. Later this week, we're going to get together with the member associations that have research directors. So there are 10, 11 member associations that have research directors in the Alliance membership. And collectively, when we convert all of the different dollars to pounds, collectively the Alliance grants about 100 million pounds in research each year. So you might think that's a drop in the bucket compared to like governments, academia, and so on. But collectively, that's a big number. And we need to have a global scorecard, as Beck said, about what's the impact of that research, what about the funding that this organization is doing. The other way that we want to do a better job of that is through the Fundamental Rights Survey. So each of the fundamental rights, ultimately, we want to have a scorecard for, to say what is the impact of the fundamental right to access to treatments, for example. How is that being respected around the world? What's the dashboard that tells us how we're collectively doing on that particular right? And we want to do that for all 11 rights of the fundamental rights for people living with ALS, and also for the caregiver rights as well, to have a scorecard that measures the global impact of those.
So one of the things that we want you to take away today is, at the very least, understanding the difference between outputs and outcomes. Sarah Wiley spoke, I believe it was in 2019, at the International Alliance meeting, and she is from MND of Western Australia. And she talked a lot about outcomes versus outputs and their journey in this process. So we're going to play a video for you.
Unlike traditional measures, such as the number of clients served or the amount of donations received, outcome measures allow an organisation to assess whether a programme is achieving its intended results. An outcome is generally described as a specific desirable result or quality of a non-profit services.
And then there's a second part to her video.
So how do we communicate our impact to them? And how can we present our outcomes in an interesting and user-friendly way? Communicating impact is not just good practice, it is also an excellent opportunity to engage donors and potential donors in our work. Clear, verifiable and effective communications around impact can be very persuasive in bringing home a charity's purpose and values to supporters. A tool increasingly being used by not-for-profits is impact reporting. Impact reporting is a communication strategy used to convey the change created by an organisation or activity and how that change was created. Crucially, it needs to be compelling. Communicating impact isn't just about sharing numbers, it's about bringing those numbers to life. In our case, it might include statistics such as the number of nights spent out of hospital and at home with family, or how many communication aids were funded by our donors. And are we maybe missing an opportunity with the meteoric rise of smartphone ownership? In 2019, 91% of Australians own a smartphone. Now, the biggest barrier to measuring outcomes is the lack of funding for such measurement. But if money wasn't an issue, could we report our impact in real time? The Australian Blood Service sends a personalised text message to you when your blood is being used, when your blood has an impact. Imagine if we could send a text message to our donors, sponsors, supporters, volunteers. Sarah, today your donation paid for Drew to receive an NIV machine, allowing him to breathe easier. Or maybe, Sarah, because of you, June and her family are attending counselling today following her recent diagnosis. Could we?
So we'll stop there with that video, but I think Cathy and I were both very inspired by Sarah's presentation. I've watched it several times. It is available on YouTube, her entire talk. And, about what real impact reporting looks like, not only in our individual organizations, but as an entire community working to end this disease. So she talked a lot about outcomes versus outputs and the difference. So we put together just a little slide here. Outputs are the things we do, as she said. They're the deliverables, the various projects that you're working on that help you towards meeting your goals. You're hoping that it brings success. You're working towards it being successful, but it doesn't necessarily guarantee it. And you might need to change things if you're not seeing that success. And then the outcome side, where you would actually do the impact reporting, are certainly the results of that. What you're hoping to get out of all of the work that you're doing. Measurable results that are defined by the success of the goal, showing that success as loudly as you can. I think we all have those different graphics that Sarah kind of had on her slide there. We all have those different graphics of the number of people that we're serving and the number of equipment, let's say, that we've delivered to the people that we serve. But how is that making an overall impact in the progress? So I wanted to give you a little bit, again, as a takeaway about the tools that are available. As Cathy pointed out, she uses something as simple as Microsoft Excel, and that is something that probably the vast majority of us have access to. You can use Microsoft Planner is another really good tool that you can use that should be free if you have a Microsoft suite of materials. And then the Microsoft Power BI is another tool that can be used, again, free if you have the Microsoft suite. The strategic platforms, the one that we use, it actually costs a little bit of money, but we use a system called Cascade Strategy. There's also a couple of other systems called Workboard and Invisio. Those require, an investment, certainly a financial investment, but it's not as large as you think. And I think that, and I'm happy to talk to any of you about what our financial investment is in our tools, but they're not as out of reach, I think, as you might think that they are. And then there are other project management tools that are out there that are extremely useful. We use Monday.com as well for our staff to kind of really measure their progress in their specific projects and all of their different tasks. That's not necessarily something that we're measuring in Cascade, but all of their various day-to-day tasks are measured sometimes through Monday, and Asana is another really good tool that you can use to measure progress. So Cathy and I wanted to talk a little bit about a call to action for all of us here. So I'm going to turn it over to Cathy to talk about that.
Yeah. So as I mentioned this morning, one of the things we're hoping to do in 2024 is expand out our satellite groups with our member associations to have discussions about specific strategic initiatives. So, we want to talk about how are you measuring impacts in your associations. If you're interested in talking about that, we can meet throughout the year, compare notes, and look at systems like Cascade versus Excel and all the other systems that Nicole just talked about, and collectively, how are we impacting the world? So looking at that global scorecard of impact and having those discussions throughout the year. We also really would like to understand the impact of the Ice Bucket Challenge 10 years ago. We all know intuitively, for anyone who's been in the field from pre-Ice Bucket Challenge to post, that the ALS M&D community has changed dramatically in the last 10 years in terms of the treatment pipeline, awareness, and so on. Some things can be directly tied back to the ALS Ice Bucket Challenge, and some things can't. So how can we collectively measure that impact? So that's something also that we want to continue to discuss through 2024 for those that are trying to measure the impact locally, nationally, or internationally for the Ice Bucket Challenge. So again, I'll remind people that in the post-conference survey, we ask a question at the end of it. If you want to have discussions about these kinds of things, just write your name in, and we'll be in contact, and we'll just be the facilitator or the enabler of that global conversation around each of these strategic imperatives.
I think that's the end of our formal presentation, but we definitely want to take some time for some questions, if you wish.
We'll start with the online community.
All right. So this question is from Kevin Robinson, Neil's ambassador, and it's for Nicole.
Yes.
It says you mentioned numerous times the focus on communicating impact to stakeholders, but not mentioned on how you're incorporating receiving communication from them. Can you touch on your process to receive feedback for the purpose of assessment?
That is a fabulous question. And as such a large organization, I would say that we do this a little bit differently in each area. I would say, let's say in each state, if you will. Our organization has grown up out of, really kind of statewide or small chapter organizations that were really measuring the quality of their services that they were delivering individually. One of the things that we haven't gotten to just yet is how to do that more as a collective. How do we ask the community that we're serving if we're doing the right things as a whole? We're just starting to kind of explore what that looks like now, so that we can start making sure that we're as effective as possible as an entire organization. But you can imagine, as large as we are, that's one of the most difficult things to do, because it can be also very subjective, depending on where you live.
Hi, thank you for that. For Nicole, I have a question. Research is one aspect of what's being measured, and it's something over all the years I've never seen anyone actually be able to measure it very well. It's just very difficult to measure the impact when it comes to, you can say the number of clinical trials that are increased or the number of papers that are published with something that you funded, but that doesn't say whether what you funded led to something that had human impact in terms of a clinical trial. So you might have funded something in the mid-2000s that really influenced, if you follow a pathway, to something that's currently in clinical trial. That's actually really impactful, small piece of funding. Are you looking at those more intangible type things to come up with metrics, and are you willing to share the metrics that you're using on research?
I'm going to have
Ask
Neil
Neil
take the question about sharing. But I'll answer the first part of that, which is as I said, in terms of the commitment of getting all of your data into a system first, that's actually how you're going to get to measuring the progress as a whole. We're not there quite yet. We have just started to really look at what measures are more appropriate. As I said, we're doing a lot of qualitative measurement, but not yet just a lot of quantitative measurement. But I'll let Neil talk a little bit about the quantitative measurement and research in particular.
Yeah, there's a couple of things we're doing. So One is we are trying to just capture the metrics of who's publishing where and then who's publishing with who and how they're citing. And so we've started to issue digital object identifiers to our grants so they're easier to track and do these automated searches. And we've been working with ResearchFish for a year. We're piloting this process to see if they can do analytics because ResearchFish is a system a lot of European funders use for their metrics. We've also done a one-off study at the 5-year Ice Bucket Challenge where we saw increases in the number of people we funded, the connections they had between themselves, and then follow-on funding. And what we did when I was at NIH is, to your earlier point, we would do tracer studies. So we would take a particular finding and we would go through all the literature backwards and see what NIH grants were part of that causal chain, that research chain that led to that current discovery. That's really expensive. I don't think that's a practical approach, but for a one-off thing, if we wanted to look at the impact of genetic therapies in ALS and where that came from, it might be worth doing a one-time study for, the 10th year anniversary. We're working on that as well, but there's no simple way that I'm aware of to do that in an automated fashion.
Can we do one more?
Just to add to that real quick, David, so Neil mentioned the 5-year study, the RTI study. I would encourage anyone in or outside of this physical room to go to our website to take a look at that, because it's not just about the ALS Association. It's really about the impact of the Ice Bucket Challenge on research in the ALS MND space globally. And we're looking at doing a similar study for the 10th anniversary as well. So we're working with an organization called RTI, Research Triangle Institute, and all of that information is public. The 5-year paper is public, and once we do the 10-year paper, we'll make that public and available to everyone as well.
Thank you. We have one more online question that we have time for, and then we'll have to wrap up for break.
Thank you. This one is from Aspa Karabella with the newly being formed Hellenic ALS Association in Greece. And she's asking, as a newly established association, we need volunteers. Can you please suggest ways you have found that work to involve volunteers in a new association? It seems they are all very overwhelmed with the issues they are dealing with their pals.
Mm-hmm. Excellent question. I'll answer, and Nicole, if you want to answer too. In terms of asking for volunteers, I would say cast a wide net. Try not to rely on the same people over and over and over again, and involve people who are not just people living with ALS and their caregivers, but allied health professionals like yourself and other community members who have an interest in and an awareness of ALS and MND. And often, in the smaller associations as they're just starting, it's often through like a clinic or a medical setting that they might know other people in the community that are perhaps interested. So I would say cast a wide net is my biggest piece of advice.
I would add to that to find various ways of engaging volunteers as well. Something that's meaningful to them, whether it's they want to advocate for funding for the disease, or they want to raise money for your organization. But they might also want to get involved in a local volunteer program helping different families in their community. There are different ways to engage volunteers as well, and having a sort of a more diverse way of engaging folks is probably a good way to attract people as well.
And I would support that entirely. I can give a personal example. After my mother passed from ALS in 2005, I'm one of 5 children, and my father was still alive. We all wanted to volunteer in some way. So my sister became a walk coordinator. My brother flipped hamburgers, because he's a chef, at walks in Ontario. My dad worked one-on-one with someone else who had ALS, and I joined the board of directors of ALS Ontario. So everyone contributed in a different way and in a different magnitude at that time, and I think that that's such an important thing, is to align with what the people want to do.